Introduction to Expert. Don't rush to this point. These exercises are focused on helping you achieve a better positioning of your tongue, especially the back third, how to keep it there with the minimal effort and how to relax in this position. These are the last stages in converting a function into a posture, from exercises which you do to posture which is how you are. The tip drop, sounds and balloon hold exercises all help with the back third of the tongue, its position, coordination and strength. Remember that it takes time to build up strength and to improve coordination. A common mistake is to rush to this point too quickly before you are ready and not realize that you gain so much more when the muscles are stronger and coordination better. The hyoid lift, as covered in Raising Your Hyoid, gives the theory on how to use suction to maintain this position, and then the max vac gives some details on how to gain the maximum suction hold. The max vax is effectively a strong suction hold. There is clearly more to a suction hold than just the suction. Many of the muscles involved have postural elements which will engage to help you to maintain this position. As long as you hold the suction, then the rest will work naturally. I often imagine the tongue as a jack-in-the-box. It is a coiled spring in a box. As long as the catch is in place and the box is closed, then there is a constant pressure pushing outwards, raising the cheekbones and midface. Mewing is all about learning, identifying and holding that catch. Tip drop. Gain a good suction hold, taking time to swallow several times so that there is a strong vacuum holding your tongue up. Then separate your lips, which will affect the suction hold, allowing the suction hold below the tongue to be released. But it is important to maintain the vacuum above the tongue. Open your mouth slightly, separating your teeth, but still hold your tongue suction to the roof of your mouth. Hold this for a second and then drop just the front 2/3 of your tongue while you hold the back third firmly in place. This is not easy and it will require a firm hold on the back third. A good training program would be 10 reps 3 times daily. Sounds. Lest we forget that our tongue is also important in making speech as well, which can be engaged as an exercise. So our tongue is very important in creating sounds. We use some very specific tongue positions to create some sounds. And thus, using sounds can be used to teach you how to achieve specific positions. We have chosen some very specific sounds for these exercises, which are bound to vary dependent on your accent and the sounds that you normally make in the language that you speak. As such, you might need to make some modifications which is outside the scope of this app. In a way, I see many of these as bouncing up and down on a trampoline with the back third of your tongue. Say, caw, caw. Repeat it and pause. Then say, unk, unk. Repeat it and pause. Then say, ark, ark. Repeat it and pause. And finally say, gar, gar. Repeat it and pause. When you pause after these sounds, your mouth should be slightly open with your lips completely relaxed, flaccid. Then, once you have mastered these sounds, try a swallow immediately after the sound while maintaining the final tongue position. In other words, make the sound freeze, holding the position. Push up slightly with the back third, which should already be pushed up, and swallow. This is not easy. It may expose you. If you have not been swallowing correctly, you may find it difficult to swallow at this point. To make this more difficult, try doing this with a chin tuck. A good exercise program is to do 10 reps 3 times a day. These exercises aims to compartmentalize the front and back areas of your tongue during several different actions of your tongue. Try to make up some sounds. We have recommended sounds which require you to raise the back third in different ways, but don't limit yourself with just these. Balloon hold. Half blow a balloon up, stop and hold the pressure. Push the tip of your tongue down and forwards against the back of the lower front teeth. Push the back third up and back so that you feel you are stretching the length of your tongue. Hold this for 10 to 30 seconds. Try repeating this with the balloon only partially full. Usually this greatly increases the pressure and thus the difficulty with this exercise. Clearly all balloons are different. Try a few different ones. The idea is to identify and isolate the back third of your tongue. A good program would be 10 reps 3 times a day. The Valsalva switch. It is possible to raise the air pressure in all the compartments of the body by pinching your nose, holding your lips together and then forcing a breath out, just like divers do to equalize the air pressure as they go deeper. It is also possible to restrict this to the area or air compartments below your larynx, the throat, effectively just your throat, chest, by using the back of your tongue, which is called the Valsalva maneuver. Closing your airway for a Valsalva maneuver and raising the back third of the tongue are very similar maneuvers, and switching between them helps you identify both. Take a deep breath. Close your airway with the back of the tongue and try to breathe out by tensing your abdominals, exactly as if you were on the toilet trying to defecate, poo. Feel what is happening around the back third of your tongue. Pump a little with your chest and abs to feel the effect on the back third. Then release the pressure in your chest, breathing out of your nose while still holding the back third of your tongue up. Make sure that you can breathe comfortably out of your nose while the back third is still working hard. Then repeat the Valsalva maneuver, completely closing your airway off and building up the air pressure in your chest again. Then release the pressure and breathe through your nose. Switch back and forth between these two states, feeling the back third and what it does. This is a good test to understand the back third of your tongue and identify if you have adequate tongue space. Some people do not and will struggle to make progress with mewing. The Valsalva maneuver is usually used to raise thoracic pressure when on the toilet. Incidentally, apparently this exercise slows your heart rate down. Holding your hyoid, the hyoid lift. Combining the chin tuck and the back third of your tongue. To do this is at a great advantage to have mastered the chin tuck and identify the back third of your tongue. First, gain a strong suction hold. Make sure that you can see your hyoid move up and stay up. You should see how this draws up the skin under your jaw, possibly sucking up any double chins. Make a chin tuck and feel the position of your tongue. Relax the chin tuck, then tuck again, then relax, then tuck, using the back third of the tongue to help with the chin tuck. Continue but slowly reduce the effort used by the neck muscles so that you're using the back third of your tongue only, swallowing as necessary to maintain the suction hold. It should be possible to relax, holding this position with the minimum of effort. Ideally, the back third of your tongue should hold this position. As long as your lips are closed, this holds the front 2/3 into position via suction. The idea is to use the neck muscles to gain the range, but the back third to maintain this position in normal posture. Using the neck muscles to maintain a more upright head position could lead to imbalance of these muscles and problems in the long term. In a way, I've always felt that the tongue is the missing column in the support of the head. There is a lot of evidence that the neck muscles and the back of the tongue are wired up to work together to maintain posture. And the tongue is the top of the deep frontal line in Thomas Myers' anatomy trains. So in my view, the tongue is the lost column of postural support for the head and neck. This can be viewed as the two pistons. The first is the front 2/3 of the tongue sucked forwards, vacuum packed against the back of the front teeth, held in position as long as the lips are sealed. The second is the hyoid and the back third of the tongue sucked up onto the roof of the mouth, held there by a suction hold. You might need some force and effort to achieve this position, but once you have, you should be able to hold this with almost no effort. The max suction hold, max vax. This is the final exercise to master after everything else, the icing on the cake. Once you have mastered all the other aspects, this is the one to work on and work on. First, gain a good suction hold with a nice chin tuck. Use the back third of the tongue to hold the chin tuck, as we covered in the hyoid lift, holding your hyoid. Then lips together, relaxed. Teeth together, butterfly bite. And tongue stuck to the roof of your mouth. Your body hanging loosely down from your core, shoulders in a good position. Then slowly draw the tongue back, a little like the plunger of a syringe, using quite a lot of force if you desire. The tip of the tongue will leave the end spot. It will affect your bite slightly. Try to maintain a butterfly bite. Your saliva will drain down, pooling on the floor of your mouth in front of your tongue, being drawn out from between your teeth, and your lips will be sucked back so they are vacuum packed against the front teeth. Make sure that they are in your desired pout position in advance. See the lips and trout pout video. Allow time for this to occur so that as much saliva as possible is drawn in to pull under the front of the tongue. Then make a sweep, with the tip of the tongue diving down to sweep up all the saliva and the tip returning to the end spot. See the suction hold for more videos detail on this. Press the tip to the end spot to trigger a mew push swallow, making a perfect tongue wave from the front to the back, overemphasizing the back third as you reach that point. Feel the wave pass down through you, all the way down through your chest and diaphragm to calm you. Feel yourself hanging from your core. See the video hanging from your core. If you are sitting down, feel your body weight pushing down through your chair with the back stacked. Then draw your tongue back again, allowing the saliva to collect under your tongue again. Use more force and time if necessary, but really draw the saliva out. When you're ready, make the perfect mew push swallow and repeat this whole process again and again. Use the tongue as a pump to completely vacuum the mouth out. Drain the saliva out until there is nothing left at all, and it almost feels dry in your mouth. Notice how the saliva becomes progressively thicker as the fluid is used up, helping to glue everything together. Then hold this, with your lips sealed so that no air can come in and the back third fully engaged. This will switch on the postural elements of your tongue so that it maintains this position without any conscious thought, as well as the vacuum physically holding your tongue up and forward in the correct position. Periodically, you should make another swallow to maintain the vacuum. It should be possible to maintain this effortlessly. This is how you should be. This is the ultimate element of mewing. Practice and practice it. Set a timer to see if you can maintain this for 1, 5, 10 or even 30 minutes or more at a time. See if you can wake up like this. Make sure that the edges of your tongue do not creep in between your teeth. Too many people do this. If you can maintain this position, then you are vaxxed. The point of mewing is to spend the maximum amount of time vaxxed. Trout pout. Skin and soft tissue molds. Ideal lip form is related to ideal function, and how you place your lips can influence their form. Your lips are largely muscle. The size and shape of muscles is determined by their use, and use over time is posture. From this and what I've seen, I believe that everyone should be able to have beautiful, full lips. It simply depends on how you use them. However, change is not easy, and most people will struggle to change, in particular as they lack tongue space. Lips are rarely too thin, they are usually rolled back from incorrect usage, in particular when they are engaged in a swallow, sucking in and backwards. There is a very specific problem which occurs too commonly and too frequently. A lot of people rest with their lips apart, the lower lip hanging down. When they swallow or want to hold their lips together, they close their lips using the muscle in the lower lip, the lower belly of orbicularis oris, and the mentalis, the chin muscle. This is the incorrect use of these two muscles, and any muscle incorrectly used will become the wrong shape and size, which looks wrong, less appealing. First, the lower belly of the orbicularis oris. While I was at uni, I had an Iranian girlfriend, nice face and lips, and I remember her drawing a line with makeup along the vermilion border. The edge of the lips, where the outer skin of your body meets the inner skin of your mouth. From what I've observed in people with really good lip form, there is a nice raised edge along the vermilion border, particularly the lower lip. And I suspect that she was trying to highlight this with lip liner to give the pretense, as makeup can, of perfection. I've also noticed that when you incorrectly or overuse the lower belly of the orbicularis oris, in particular by engaging it to close the lips or in a swallow, then this muscle gets larger. In effect, it swells up so that it completely obliterates this fine, well-raised edge on the vermilion border. What is interesting is that it looks wrong, and why comes back to my concept of the face being the CV of your health. By definition, being healthy is being attractive. To a greater or lesser degree, we are hardwired to be attracted to healthy partners, and we inherently know what is good form. Good shape is. Then the mentalis muscle. This muscle runs down and forwards from the bone near the roots of the lower front teeth to fan out and attach to just under the skin at the front of the chin. When it contracts, it pulls this skin in and up, puckering the skin slightly as it does. This affects the lower lip, pulling it back and up, which helps to close it. The problem is that overusing this muscle tends to roll or invert the lower lip, making it look thicker than it actually is. Hanging from your core. I've heard many professionals talk of the importance of having a strong core, but I worry that few people understand what this means, and it makes more sense to me to describe it as hanging from the back third of your tongue. Gain a good suction hold with your hyoid raised and chin tucked, and your shoulders should be in the right position. See the shoulders video. Then relax, as you should be able to do this with the minimum effort and go about your daily tasks. Effectively, you are now hanging from your central body, your core. Now, a top tip. For the first 10 minutes of every day, just as you wake up, walk around on the tips of your toes, jumping up and down a little by flexing and extending your feet, feeling your shoulders hanging relaxed from your core, your spine stacked and balanced and comfortable, your head perfectly balanced on top of all of this. Make a circle with your head, feeling its weight pull you in a circle. The circle you make with your head should match the circle that you feel your body is being pulled in. A good way to remember to do this is to set a special alarm or place a note you see when you wake up, possibly on the bathroom door. Good posture should be easy and efficient without any effort. The core muscles, especially the back of the tongue, should be doing the work naturally without any assistance.